pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. Are there any members of the public here to comment on a non-agenda, on an item that's not on the agenda? Apparently not. Next item is approval of minutes. Do we have a motion?
Move approval.
Second.
Okay, we have a motion and a second. All in favor?
Aye.
Aye. Any opposed? Any abstentions? Okay, thank you. Next item is the consent calendar. Motion, Pierce, second by Taylor. All in favor?
Aye.
Is anyone opposed? No abstentions? Okay, consent calendar is approved unanimously. And with that, we quickly move to regular agenda items. Item 4B6, review and discussion of MTC's proposed community-based transportation planning program guidelines.
Good evening, Mr. Chairman, Commissioners. I'm Martin Engelman, Deputy Executive Director for Planning at CCTA, and I'm here tonight to tell you about a new cycle of funding that's coming down from MTC to the CMAs through the second round of One Bay Area Grant, also known as OBAG 2. MTC is in the process of allocating $1.5 million to the CMAs to conduct community-based transportation plans. New acronym we'll have to learn called CBTPs. CBTPs are intended to identify projects and programs that improve access and mobility for low-income residents. The plans focus on so-called communities of concern, which are defined by MTC as areas where 30% of households are below the federal poverty level and 70% are minority. Because the cost of living in the Bay Area is so high, for the Bay region, the definition of poverty is 200% of the national level, or double the national poverty level. In Contra Costa, MTC has identified communities of concern in Richmond, Bay Point, Martinez, Concord, and East Brentwood. Back in 2002, when this program was first unveiled, the authority oversaw 4 CBTPs, and each plan costs about $60,000, and each plan was developed through an extensive community outreach process where the local jurisdiction staff went into the neighborhoods, into the communities, and got information about the challenges and barriers that low-income residents face in trying to get to work, trying to get to school, to shopping centers, and to health clinics and government offices. From these plans sprung an array of projects funded through the MTC Lifeline program, through Measure C, and through other state and local sources, as well as through volunteer efforts. When the authority's planning committee discussed this item on January 3rd, that was one of their questions. Do these plans result in anything tangible, or do they just sit on the shelf? And to answer that question, since the planning committee met, we've gone through and listed on page 4B6-4 and 5 the projects and programs that sprung from these plans. And as you can see, it's a multifaceted approach, and it resulted in projects and programs ranging from traditional transit service to shuttle service, improved bus shelters, pedestrian and bikeway improvements, and car sharing programs. Much has changed, however, since this last round of CBTPs was completed. And as he probably noted in the board letter, all of our plans are more than 5 years old. And under MTC's proposed guidance for this new funding source, all of them should be updated. However, we probably don't have enough funding to update all of them, since they used to cost $60,000. Today, they're upwards of $75,000 each. We have to go out into the communities, collect all new data, have new community outreach, and then develop a plan, usually through consulting services. We only have $215,000 to work with, but we are going to do some reconnaissance, meet with the local jurisdictions, see if they're interested in updating the plans. We'll have to pick and choose later which ones we update, and we also might be able to increase that funding pot using other sources if we can locate them or identify them. So to launch this next round of funding, MTC has updated its guidelines, which are included in your packet as Attachment A. And the attachment is a draft of MTC Resolution 4316, which actually went to the MTC Planning Committee in December, was supposed to go to the Commission, but it was postponed to give the CMAs, who are responsible for implementing this thing, an opportunity to review the guidelines. Those guidelines lay out the conditions for using the funds and conducting the CBTPs. As I mentioned, $215,000 comes to Contra Costa, and this is based on a formula of how many low-income residents we have compared to the rest of the Bay Area. The goals of the program are to improve access and mobility for low-income communities and to engage residents and community organizations in conducting the analysis and shaping the recommendations. We'll need to, under these revised guidelines, and they did change them since December, create a steering committee. We intended to do that all along, and that committee would include social service agencies and community-based organizations. I think that's what we did last time, so that's nothing new, though it was added since the last time MTC saw these guidelines. A local match is required, 10%, and we could use planning funds and local in-kind staff service or staff time for that. Eligible uses of these funds are essentially for the studies themselves, and the Planning Committee did ask January 3rd whether we could use some of the study funds for implementation. And in my discussions with MTC staff, they've indicated that these funds are for the studies and that other funding through the Lifeline Transportation Program would become available for implementation. Authority staff is looking forward to working with the cities and the county to undertake the new round of CBTPs, and we recommend that you approve the guidelines, which will come before the full MTC Commission on January 24th for approval. If you have any comments or concerns tonight, staff can convey those to MTCs via email tomorrow, and follow-up discussion could occur at the Commission meeting through our MTC representatives. This concludes my overview of the item, and I'd be happy to answer any questions.
Anybody have questions? Commissioner Arner.
Martin, thank you. I'm not on PC, so I do have a couple of questions. Ultimately, I mean, this is interesting. Everybody competes to get money, but this is to do a study. I concur with PC's recommendation to try to see if we can redo it, but things have changed, and we got to figure out to make sure we do it. If we're going to do it well. But ultimately, Measure J, because it's voter approved, the uses of the money and where it goes and pretty much the programs have been prescribed, and we have some tolerance of what we can do with that. New monies. What's the implication, I guess is the question, because I'm a little concerned that going forward, that MTC is going to put us in a position where we've had to change a priority, but yet it's not a voter approved. And will this create a conflict with what we're doing ultimately for what they're looking, their reasoning for doing this has changed slightly from the past? And does anybody have any concern, Julie or Amy, because you guys are up there at MTC? That's my only concern. And maybe it's not a concern, just what ultimately are they going to do with it? How will it impact what we're doing at this agency?
Commissioner Worth.
Good. Thank you, Mr. Chair. And then, Julie, unless you want to jump in. I think that's a very good question. Our feeling was that what the intent is actually to put this in the hands of the CMAs in terms of making the local decisions with the projects we have. Now, and so I think it's entirely consistent with Measure J and also with Measure X, the things we talked about when we developed that expenditure plan and program. I think we have to be mindful always of, kind of what the regional priorities are in terms of the types and locations of projects, and it always is a balancing act for Contra Costa County because of the diversity of our county. But I believe that this is consistent with what we have been doing, and we're actually a little bit ahead in terms of the process that we've gone through to sort of develop priorities. But it's consistent. But good question.
Commissioner Pierce.
Yeah, I would agree with that. We had a lively discussion at the Planning Committee meeting, and I carried that discussion on to the MTC meeting last week. And I was admonished that as much as we might like to spend some of these dollars on something other than a plan, which we thought we had pretty good plans in place, but to, touch base with the communities and make sure that the plans are updated to today's needs and make sure that what we implemented from the last plans was still working, and were there tweaks we could make that would make them better, but could we use some of the money for projects? I was admonished both at MTC and again tonight that no, we can't use them for actual implementation. We must use them for the planning, that there's lots of other sources for the implementation. And so I was also told, though, that there were some feelings that some of the things that we were trying to implement maybe had not gone far enough or could use some improvement. And that was the reason for going back with the plans, to really do a little more thorough job and see if there were ways that we could do better. Some of the projects that we have done, and I remember we did the community engagement last time because I was out there at several meetings in the Monument Corridor with some of the social service agencies, talking to the people who actually use the Monument Shuttle and what would make it better for them and that kind of thing. So I think we've done a good job of it in the past. We do need to touch base. Hopefully we can look to see if these are the only locations we need to do, or are there other sort of nuanced areas that are adjacent to some of these, because some of the demographics have shifted significantly in the last 10 to 15 years. And so we need to find out exactly what the needs are today versus what they were back in 2004 or 5 when we did them before. So I think I'm on board. I'm willing to be convinced that we need to do a better job of the planning. I think it's totally consistent with what we're trying to do to reach out to our underserved communities. And that there are probably some new creative things we can do that we didn't have the ability to do before.
Thank you, Julie.
With that, I would move the item.
Second.
Okay, we have what is the motion to do what? It says here, review and comment on the proposed guidelines is appropriate. So does this require a vote or?
supposed to agree to them, right? Or is this
Yes, so these were proposed by PC with staff.
So the motion is to approve the proposed guidelines, right? Okay, all right. All in favor? Aye. Any opposed? Any abstentions? Okay, thank you. Next item is correspondence and communications. Is there anything anybody wants to highlight on that? Next item, associated committee reports. Are there any? Commissioner and staff comments, chair comments and reports. This is my last meeting, but I'll comment on that next month. Commissioners' comments and reports. Executive staff comments.
Commissioners, Happy New Year. Right, Happy New Year.
Yeah.
I wanted to highlight a couple points in the report that I present to you today. One is we're starting a quarterly bicycle coordination meeting with several members of the bicycle community to take a look at our plans to make sure that they meet their needs so that it's easier to make adjustments during the planning and design phase than it is in construction. So the idea is to make sure that we have comprehensive plans that address all the issues for mobility. And so Tim has taken it upon himself and has set up these meetings. And so far, I think we've had one or two. One, and it went very well. The next point on this first page is the Federal Highway Administration has developed a modeling group because a lot of us are complaining about the fact that we can't model the future. And so Matt Kelly is on that committee, and hopefully we'll get some better tools to model the future so that we're not making the wrong investments. And so the issue is, by the time you get a project ready to go, and by the way, good planning equals good projects. I just want to say that, because if you don't do the planning process well, you're going to end up with a poor project. And so you want to make sure you do the planning right. Did I just say that as an engineer? Anyway, so Matt Kelly's on this Federal Highway Administration working group, so that's exciting. North Dakota Transportation Department paid us a visit. They want to do innovation. So did the county of San Mateo. So we briefed them. Ivan's not here. He's at a panel meeting in Washington, D.C. for the National Cooperative Highway Research Program sponsored by the Transportation Research Board. But we're asked to conduct a webinar on our construction innovations. So our online bidding, our e-inspection, paperless inspection, and our drones. And so I think it's an honor that we get asked to do that. And the last thing is, we'll bring back to you, I believe in April, Randy Carlton, the team has gone to Planet Bids, and so we're advertising everything online. So this saves an unbelievable amount of time, and then it helps reduce errors because all the information is in the database. And so it's pretty slick how it works. It goes out to 600 vendors that we've got a procurement on the street, and then they, in turn, apply and download the information, so it's completely paperless. You can, when you're on a panel, you can request the documents via email, or you can ask for paper. And so Randy's going to do that sometime in April. So we'll be back to you. So if there are no questions, I'm finished.
That's great.
Thank you.
Is that it?
That's it for me.
Okay, yeah. Any comments or questions on the calendar?
I have so we have a new BART representative that's going to take Nikki's place. Elaine? Eileen Hernandez. I knew her last name. I can't remember Eileen. So she's now going to be the liaison from BART to CCTA. So welcome. You're welcome.
Welcome. Okay, we talked about the calendar, right? Anything else? Meeting adjourned. 19 minutes. 19 minutes.